Welcome back. In the next segment, we decided to focus on eczema's patients' mental health and the impact of it on their lives. Eczema is a skin condition that can affect more than just the body. It often leaves a psychological imprint on those who suffer from it. So we are honored today to host Dr.Najah Alenezi, a consultant psychiatric at Jabir Ahmed Hospital, to discuss with her how eczema influences patients' mental health and how these emotions can impact their daily life. We will explore strategies and methods that help patients cope with the feelings of anxiety and stress, empowering them to live positively with their condition. And with your name, we would like to welcome Dr. Najah. Welcome to Medical Talk.
My pleasure. Thank you, Dr. Mohammed, for having me today.
Thank you so much. I am so happy that I have this conversation with you. The reason why is because, first of all, on a personal level, I'm obsessed with psychology and psychiatry, okay? And I think it's a very important component of the whole health system scheme. And I have so many questions. I'm gonna start with, if you can describe the common psychological effects that atopic dermatitis can have on a patient.
To start with, atopic dermatitis, as Dr. Nof mentioned, it is a chronic dermatological disease that starts at early or young age. We'll talk or emphasize more during the puberty, which is the early adolescence phase, attacking the visible areas of the body, face, hands, and arm. This visibility would lead to heightened self-consciousness, embarrassment, shyness, social withdrawal, and definitely this will go to poor body image and low self-esteem.
So it definitely has an impact.
Yes, especially in the severe cases that causes scarring and this.
When it's more visible, basically.
Yes, it's more.
I want to talk about chronic itching. Me and Dr. Nof, we were talking earlier about this. How does chronic itching and discomfort, basically, affect the person's mental health over time?
To start with, itching is distressing in terms of that, especially if it attacks you at night, it would affect the quality of your sleep. And when your sleep is affected, you will have second day feeling fatigue, tired, cognitive dull, impaired, and on the chronic basis, this would may lead to anxiety or depression. Itching socially is not accepting. As Dr. Nof mentioned, it looks like as if you are having a contagious disease. So in both level, itching is really distressing to patients.
I'm glad that you mentioned sleeping, because this is my next question, is that the link. Can you explain to our viewers the link between sleep disturbances and mood changes in eczema patient, basically?
Now, this is my area. You know, when talk about sleep, after working 25 years in psychiatric hospital, seeing thousands and thousands of patients, I can bravely say there is no mental disorder that does not have a sleep problems. All mental disorders have a sleep quality problems. Either they have interrupted sleep, disturbed sleep, quality of sleep is affected, they have decreased need of sleep. So in particular, patients with atopic dermatitis, they are no different than other patients. If they have like a depression, they will have a poor sleep quality. If they have anxiety, it is the same. And if they are having itching, that is a physical complaint that prevents them from having a good night's sleep, this definitely would lead to, as I mentioned, a psychological impact on second days or on their lives.
So I think you would agree that sleeping disturbance is almost like the common denominator that shares with all other mental health status, basically.
Yes.
So it's quite important. Now I want to ask you something that I don't know if it might be related or not. Because stress could be multifactorial, but psychiatric or emotional stress can play a role in triggering or worsening, basically, eczema symptoms.
Well, definitely, it's related. The stress exerts its effect via hypothalamic pituitary adrenal axis, which is, known as the stress hormones. Also, there is a neurobiological link between having a dermatological disorder and the psychological impact or effect. Both, they have a bidirectional relationship, which means that patients may suffer from stress, and this would increase or worsen their symptoms or making it more treatment resistance.
Exactly. Okay. And it's not only dermatology, as you said. Stress could cause them. It
affects your diabetes, hypertension, almost everywhere. There is even a branch in psychiatry called psychosomatic disease.
Yes.
Psychosomatic disease will include all the all medicine. I mean, that's it. Sorry.
Absolutely. And now it's like a vicious cycle. Basically, it always come back to psychiatry, and then
I cannot agree more. Yes. Yeah.
So that's why I meant, because you play a vital role in this whole process. We do have more questions, but we have to take a short break. We'll be right back. Stay with us. Welcome back. We're still talking to Dr. Najah Alenezi. Dr. Najah, before the break, we were talking about the triggers and some of the common points regarding the mental health for patients with eczema. Now, my next question is that in terms of social interactions for these patients, how does living with eczema, in your opinion, affect the patient's social interaction? Because, as you know, we know that social interaction is very important.
Yes, definitely. Let's start with in what age they are having eczema, and if they are having a severe one, led to a scarring of the face. Can you imagine, like a child, a boy around his adolescence, or a girl, and if she has like a scarring in her face, how she will interact? She will be able to have friends as the girls that they are not having these skin lesions? Some would perceive, or they perceive themselves as if they are inadequate in some terms. They will be preferring to be socially withdrawn. And I'm talking about the severe cases especially.
So basically, what you mean by like a teenager might experience different...
Because at this time, it is the time that you will have a relationship that may last to your adulthood. Making friends, social gatherings, exercise, swimming, other, sports and action leads to work within a group. And those people, some of them, I mean, the severe cases, will be deprived from all these things.
Exactly. And specifically, this condition could actually be triggered or cured at any point of their life. And some people, they have it, as you mentioned early. Some people, they may have it late in life. It might affect your marriage. It might affect your work, your interactions. Somebody who is used to go in public a lot.
Yes.
You know what I mean? So how do you deal with that?
Try to identify in which level we are in. Are we dealing with a depression secondary to eczema? Are we dealing with an anxiety disorder secondary to eczema? Are we dealing with adjustment disorder secondary to eczema? To study the impact, we need to know at which level your patient is in, and accordingly you will treat. Either you will treat maybe coming questions about the modality of a treatment, but there is a different treatment for each one of these disorders.
Exactly, because my next question is, as you know, there is a pharmacological line of managing these conditions, and there is non-pharmacological line. I don't want to talk about the pharmacological right now. I want to start with the simple basic steps that we can do to our patients in terms of non-pharmacology. What do we...
As a psychiatrist, or as a dermatologist, or as a family?
I want to get your perspective first, and what you think the others should actually do to make your life easier, basically, and potentially the patient's life easier.
So As I mentioned before, each case has a different story or a different scenario, different level of severity, and the impact of psychological impact of their atopic dermatitis on their life is different. Based on each case, we will tailed a management plan that suit this boy or this girl, the patient in their aspects, in different aspects, and in their needs. So having tailed this modality of a treatment, it may include cognitive behavioral therapy, it may include supportive therapy, family therapy. I do believe from my experience that the best management is when, in severe cases, when dermatologists and psychiatrists work together.
So in terms of mental health support options, what's basically available for these patients?
I prefer to start with cognitive behavioral therapy, supportive therapy, and please, and I want to send this message. Antidepressant and anxiolytic are not addictive medications. If they are used properly with the dose prescribed. So yeah, to start with, antidepressant is never addictive. Anxiolytic, some of them, the short-acting anxiolytic treatment may cause like a dependence, but if they're prescribed by a psychiatrist, it will never cause you to be a dependent on them. So you may need them for a short period to overcome your stress and your and you will see the impact of treating your depression or anxiety on your atopic dermatitis in terms of less symptoms, more effective treatments, less flaring of the, less itching, because you are treating the stress that
it goes back to the square one basically, and you reduce the stress, and basically you maintain better results. And I think we should highlight to our viewers, as doctors, they should understand that we don't take antidepressant medication very lightly. It's very, very specific, as you said, and we do not prescribe it for any case unless the patient really needs it, and for a specific.
They are safe medication.
They are, but the problem is the reputation, the bad reputation I think they get.
Okay, still we have this stigma. We are fighting this stigma. But no, they are safe, very safe medication.
If they prescribed by the proper physician, basically. Now I want to ask you about some of the stories. You mentioned your experience.
Yes.
I asked the same question.
I'm lucky in Jaber Hospital because my clinic, our psychiatry department.
Yes.
Our neighbor are the dermatologists.
Okay.
So they sent me the cases when they notice
any signs.
Signs of there is a direct psychological impact of their dermatological disorders, diseases on patients. I do remember patients, maybe I talked to Dr. Anof in the break, as you were having psoriasis, and another patient was having atopic dermatitis. Both showed poor response on treatment. When they were treated, one of them were diagnosed as adjustment disorder, and the second one was diagnosed as major depressive disorder, treated and did very well. 80% of their symptoms disappeared.
Wow, that's a success story right there.
It is a success story.
May I ask about the age we're talking about?
Middle age.
Middle age, like 20s?
One of them was 20s and one of them was 38.
Okay. From your experience, would you say that females are more prone or affected than males, or is it basically gender doesn't play a factor here?
I believe boys in the early stage around puberty more effective than girls. Girls tend to cover their skin lesions with makeup. Boys cannot do that. And the feeling that girls, they will do like other measures to look prettier, boys cannot do that. But still, when we talk about the anxiety and the depression, anxiety is equal in both males and females. Depression is slightly more in females. In Kuwait, I see depressed men and women exactly, almost equal.
Oh, almost equal?
Yeah, almost equal.
That's fine. Because the reason I ask you, because, in each culture they have their own, basically, elements. And some may say that, males are more, prone to having psychological impact. Some say females may have more psychological impact, but then again, we don't know. And I think the literature, we need to study that a bit more, depend on the region or the area for that. Any last advice you would give to our viewers?
I believe, as WHO mentioned, there is no health without mental health. Always address any psychological impact of a disorder carefully, and collaboration between psychiatrists and other medical subspecialty will be helpful to patients.
Dr. Najah Alenezi, thank you so much for being with us and sharing all this valuable information.
My pleasure.
Thank you so much. Dear viewers, we still have more. Stay with us.